My name is Eduardo Martinez. Later you will see my picture so you can associate it with a voice. Obamacare Plus Plus, why we need it, with example, facts, and numbers. Unquestionable. A president that put the people before the dollars. That's an actual receipt from Guatemala, Patronato de Pacientes Diabéticos de Guatemala. That's for 10 vials of 10 ml each. It's 1480 quetzales, which converted to dollars, it's 77 per dollar, which is the cost is $1.92 per ml. $1.92 per ml of insulin, 70/30 Humulin, same thing as in America, made by the same manufacturer. That's an actual receipt from the pharmacy at the US. The cost will be $35 copay, plus the insurance, Medicare will pay $305 for 30 ml. That's $340. That's 11.35 US dollars per ml. Guatemala is $1.92 per ml, and the US is $11.35. 6 times more expensive than the US. Guatemala, Nicaragua, El Salvador, Canada, Europe, the world is cheaper. Prescription drugs are more expensive in the US, no matter what type. Not only insulin. Drug companies are ripping off the American consumer. They held them hostages. Drug companies, all about greed. The US is a runner-up on worst nation on gross national product. On healthcare is 18%. GNP is all the products manufactured in the country and all the services. 18% goes to healthcare in America. While in Nicaragua, on 2014, I had to go to the hospital. I went to Hospital Alemán in Managua, Nicaragua. No cost to me as an American citizen, free medication, free treatment. Nicaragua, 5% of the US economy. I went to the hospital at 8:30. I left at 11:15 p.m. Less than 3 hours. No bad for the poorest countries, Hispanic poorest country in the world. When I showed up my American Medicare HMO card, it's no good. We'll take care of you at the cost of the Nicaraguan government. No bills to pay. Can it happen in America to a tourist that comes here, goes to the hospital? Is he, hurried for money to pay? It doesn't happen in America. When countries with 5% of the US economy show an example in areas of healthcare, for the US, our US healthcare system is catastrophic for consumer. Joan Boner, get your shit together. Put a proposal on the table better than the Obamacare or shut up on it. The Medicare gap shit. That is what I had. The drug cost in June for me, for a Medicare recipient that I don't have Medicaid, Lantus insulin must have 312. Novolox 7030 insulin must have 269. Janomet diabetes medication 398. I can substitute that with a less effective medication. But the gap, after $3,000, Medicare people that don't have Medicaid have to pay a huge amount, of their medications as a copay until they reach $4,500. People on Social Security or disability, that's a tough thing to do. $980, almost $1,000, a big chunk of my disability payment. Do you want a Republican as a president? Well, if you want Affordable Health Care Act and you're not rich, you don't want a Republican. Now, this is impressive. Of the 192 countries in the world, 55% have single digit of their GNP that goes for health care. And you have strong economies and weak economies, as you see there, that if United States is at 18% is 100, that's what their usage level is for Switzerland, Canada, Germany, Denmark, France. They're not third world countries. They're not poor countries. They're strong economies. And some of them are even stronger than the U.S. Yet, look at the figures. Look at the figures at weaker economies like Nicaragua, 43%, Libya, 17%, Argentina, 46%, Panama, 49%. So they're all do better than the U.S. And no matter if you look at the internet for 2010, 2011, 2012, 2014, you'll see the same pattern in the U.S. A contender for the worst healthcare, the most expensive in the world. These are some amazing facts that some people may not know. RX sold in the U.S. at local pharmacies, some of them are manufactured outside. Yet the government makes it difficult to obtain RX from outside the country, saying it's not safe, this, that. And more amazing is some U.S. hospital, when you get a scan or you get other tests, they send it to India to be read by a non-licensed U.S. doctor. It's billed to the patient in dollars, not in rupees, because it's cheaper for them. They make more money. Greed is ahead. Therefore, the legal special interest groups keep hostage the U.S. consumer pockets. I thank Walmart for the $4 prescription generic push. I remember when I used to want to buy glyburide or metmorphin or whatever, generic medication, it'd be like $40. Now it's $4. Yes, U.S. is a good country to live. It can be better with an Obamacare plus. That is my picture, so you can associate who's talking to you. Thank you very much.